Professor Pat McGorry, thanks for being here. As always, you're meeting some of the key players today and tomorrow.
Yeah, I think, as you say, that this is one of the major public health issues and crises actually facing Australia. We've got a whole generation of young people who are facing the scrap heap pretty much, with a 50% surge in mental illness in this age group, teenagers, young adults, so much so that 2 out of 5 young people need professional help these days, which is staggering to hear, isn't it?
And what age is that?
This is teenagers, young adults.
So from 13 upwards?
Yeah, 12 to 25. And the good news is Australia is well positioned to deal with it because we've built things like Headspace and backup systems to a degree, but the volume of need is just overwhelming in the system. And so, urgent action is necessary. We have the blueprints for government or alternative government to look at, to implement.
What needs to happen?
Well, we need particularly what we call the missing middle, the young people who are too complex for a GP or a Headspace centre to kind of get to recovery mode. They need specialist care. And as we know, the state-funded mental health systems, not only are they not up to the task, but they're falling apart. I mean, you look at New South Wales with the resignation of 2/3 of the psychiatrists. You look at Victoria with the Royal Commission, which hasn't changed much so far. The state governments cannot actually meet.
So with those psychiatrists walking off the job, though, in New South Wales, what happens now?
Well, I was working...
Is there some peace deal?
I really don't know. It's a symptom of a much deeper malaise in the mental health system in every state and territory. It's just a symptom, really. I was working in Coffs Harbour in the Headspace last Friday, and we had incredible difficulty getting our severely ill patients to be treated by the public mental health system in that regional area. And that's happening all over New South Wales. It's happening across Australia. There's a missing middle problem.
Do we have the people, though?
Care.
Do we have the people, even if the dollars went in, are there the experts? Are there people like you ready to help?
Well, not enough. So workforce is definitely, we can't fix it overnight, but we've got to build in a series of stages a new system of care for the more specialised needs of young people. And if we do that, there will be a massive return on investment. It's unlike the NDIS, it's unlike cancer. No. You get a return on
massive return.
Massive return. And
because you spend less on health later because of the gains made when
you spend less on social security, you get more tax receipts, you get a stronger generation of future contributors and leaders. Productivity increases. It's a no-brainer, but we have got the solutions. Australia is the country in the world that has developed these innovations. We just need to invest in them and we'll get the return.
And you're here to try and get the attention of the political leaders. Well,
we usually get more attention
yeah?
at this time in the election cycle, so I'm really hoping that we can get engagement from all sides of politics around this issue.
It sounds like it's promising, though, from what I hear.
I think it's promising, yeah. We're getting a good hearing, and I think the public need to understand this is in their interest, that every family in Australia can benefit from this.
100%. Great to see you.
Thank you, Kieran.
Soon.
Thank you.